Our athletic training profession or major here at Hofstra really encompasses the individual who wants to take their undergraduate work here and then go on to become a certified athletic trainer. Once they complete their bachelor's degree and they have their clinical hours completed, they can sit for their BOC exam. We have some students that continue on for their master's program in athletic training, or some students that move on to PA school, physical therapy school, or even teaching. Once the students are accepted into the program, which is typically at the end of their freshman year, they'll be required to partake in 6 clinical experiences through the next 3 years. Most of those clinical experiences or rotations take place here on campus with our various sports teams and our staff athletic trainers. We also have some off-site affiliations with local colleges, high schools, and physical therapy clinics. We have a lot of opportunity to do different professional affiliations and seminars. We have a large base of alumni group that are employed from the professional level down to the high school. Our students are really involved in the National Athletic Trainers Association, which is our national governing association. And then we have our 2 local ones, which is the New York State Athletic Trainers Association and the EATA, which is the Eastern Athletic Trainers Associations. The Eastern Athletic Training Association has a convention once a year, as well as the NATA, and a majority of our students partake in those conferences. 2 students this year were awarded with a New York State scholarship and an Eastern Athletic Training Association scholarship because of their work here, their high GPA, and their involvement in their outside curricular activities. The students do have a lot of facilities here directly on campus to work with. The new arena, the basketball arena, we have an athletic training facility in that arena. We have an athletic training facility over at the PFC, and then we have another athletic training facility over here at Margiata. There is a difference between athletic training and personal training. Here at Hofstra, there is a personal training course offered through our continuing education, where somebody would come for 6 months, take the personal training class, and then be certified to be a personal trainer, to work in a gym and to set up exercise programs for healthy individuals. Athletic training requires a bachelor's degree, so it's a 4-year program where students would complete the program along with 800 to 1,000 clinical hours, and then they would sit and take their board of certification exam to become certified athletic trainers, which are recognized healthcare professionals. We also have an exercise science program here at Hofstra, which is an undergraduate degree. So in the exercise science program, those students are educated in dealing with setting up exercise programs and exercise prescriptions more geared towards the healthy individuals. The athletic trainers work through the injury rehab and the injury diagnosis and process of the injured patient. The career in athletic training is growing. The trend is growing the past couple of years because we're finding that a lot of other typical traditional settings where athletic trainers are employed, it's being expanded. Traditionally, you've seen athletic trainers at the colleges, the high schools, the professional levels. Now we're reaching out to X Factor games, athletic trainers with the Olympic sports, traveling with them and being with them more year-round rather than on-site during their competition. The Biggest Loser, the TV commercial, they have a full-time certified athletic trainer. So I think people are realizing the education level and what athletic trainers can do for their organizations. So they are starting to employ more and more athletic trainers outside of that traditional, school setting.